February is American Heart Month and a great time to raise awareness of heart disease, which is the leading cause of death in our country. Joining us today is our expert from Commonwealth Care Alliance. Dr. Laura Clapper is the medical director for CCA Health California. In this role, Dr. Clapper collaborates with providers to help members get access to medical, mental health, and social support services in an integrated model. Welcome. We're so happy to have you on this morning.
Thanks for having me. Nice to meet you.
Yeah, nice to meet you as well. So I wanted to ask you, what are some risk factors for heart disease?
You know, there's several key risk factors for heart disease that affect both genders. One of them is obesity. There's also tobacco or smoking, diabetes, high blood pressure, and a family history of heart disease.
All right, and those sound like some pretty common health issues. Do any other factors put people at risk?
There's actually these are affect both genders, and have increased heart disease in different ethnic communities. So Black and Hispanic populations are a higher risk for heart disease, as well as we've had a rapidly increasing cardiovascular disease in Asian communities. So it's really important, if you're in these communities, to talk to your physician about your heart disease risk and what you can do to lower your risk.
Yeah, knowing that this disease is so common, could you share a few tips that people can implement to improve their heart health?
So one of the best tips is, one, keep moving. And two, know your numbers. And when I talk about knowing your numbers, you want to know what your blood pressure number is. Sometimes people are a little afraid to check on their numbers, but it's really important to get your number, talk to your doctor about it. There's things your doctor can do to work with you and help you manage it. So it can be both medication, but there's also a lot of lifestyle changes that can go into managing your blood pressure. In addition, knowing your cholesterol number is really important, and that's just a simple blood test your doctor can do. There's good and bad cholesterol, and your doctor can work with you on how to lower it, and there's medications you can take to lower it, and again, many lifestyle changes you can make to lower it, both from your diet and exercise.
All right, all helpful tips to know. And is there anything you'd like to share that people might not expect when it comes to heart health?
One of the things that I think is really important is to think about your mental health. And that's one of the things, as a CCA medical director, I really have found that it's really important in terms of how the medical, mental health, and social services, your community, all fit together. People with depression have a 64% higher chance of heart disease, according to the American Heart Association. And people with heart disease also have a higher risk of depression. So if you're feeling lonely, you're feeling sad, depressed, talk to your doctor. Whether you have heart disease or you're concerned that you have depression and you want to know if you're at higher risk for heart disease, those are really important topics to talk to your doctor about and come up with a plan about how you can address them.
Yeah, I like that you
And
pointed.
for loneliness, yeah.
I like that you pointed that out, talking to your doctor, not just keeping everything to yourself. If you could give everyone one tip that they can do today for heart health, what would it be?
The number one tip I would say is walking. And sometimes if you haven't been walking, just take that first step. Walk around the block. If you have a walker, you use a cane, need assistance, just go out there, use your walker, ask a friend to go with you, because that's part of it, is going outside, seeing nature, talking with a friend, and then doing some exercise. That's really important for your heart health, and not only going to be good for prevention, but also for stopping progression of heart disease.
All righty, that makes a lot of sense. Getting some movement in. I'm going to take that lesson today. I'm going to get a little run in today because you told me to, Laura. Thanks for coming on.
All right. Thank you for having me.
Of course.